Namaskar. I'm Dr. V Sharma, Senior Orthopaedic Surgeon, Ramlal Kundan Orthopaedic Hospital and Trauma Center, New Delhi. I shall be sharing few tips for a layman in case you encounter someone with a fracture. So the first tip is don't panic. You must be in control of yourself for making a proper assessment. And if possible, call for help from people who are around so that you have more than one people around. A quick assessment must be made of the fracture, and you should also see a fracture usually is a limb injury, but often there can be cases of polytrauma that they may be associated injuries, abdominal injuries, chest injury or head injury or any other injury. So quickly make an assessment about the main fracture or in case there are any associated injuries. Now the main issues in case of fracture are like first is pain. So what you can do for the pain is apply some ice packs, and second issue is deformity. So with your common sense, if you can try and realign the fracture in case you see a gross deformity. That in itself may relieve the pain to quite an extent. And another very important point in case of fracture of the limbs is whether it's an open fracture. In case it's a bad injury and you can see the underlying tissue exposed, the skin is, there's a breach of the skin and maybe the bone and the muscles are exposed, then exposure causing infection and there may be bleeding, hemorrhage going on. So you need to try to get sterile, clean compression bandage. That is very important because that's the only thing you can do to control the bleeding in such cases is give a good compression dressing. And special mention in case of spine injury, you must not try to make the patient sit or stand, which is the case in some cases. People say, okay, just walk a little bit, everything will be okay. So in case of spine injury, make sure the patient is completely horizontal and you don't move abnormally. And last point is, if you think it's a major fracture, the patient may be requiring some kind of surgical procedure in few hours. So make sure you don't give anything to eat or drink to the patient. Keep the patient fasting. So take care of all these points and you've done a great job. And the last point left is make sure one of the people who are helping meanwhile arrange for a transportation to a triage unit or to the nearest hospital. Thank you so much.